The Ebola virus is transmitted by a myriad of different methods. The virus is primarily transmitted among humans through any type of physical contact with infected bodily fluids, such as feces, vomit, urination, and blood. The most infectious agent amongst these fluids is blood. Further research indicates that this virus can potentially be detected in breast milk, saliva, tears, and semen. Nonetheless, the research indicating risk of transmission by saliva and tears is inconclusive and has not proved to show a significant correlation. The mechanism in which the virus can be transmitted indirectly would be from contact with a contaminated object or surface. Additionally, indirect contact with a surface or object that has previously been contaminated does not pose the same threat or risk of transmission as direct contact with bodily fluids. Mechanisms that are used to control the virus itself and spread of the disease are multifaceted. In order for a community to successfully control the spread of a virus, there needs to be a symbiotic relationship between community officials, leaders, and the population. There are general precautions and control factors that the community initiates with the Ebola epidemic. Community engagement is considered the primary key to success in controlling the spread of the virus. The responsibilities of the affected communities are to effectively apply a system of health-oriented interventions to reach the entire population. Some examples of community engagement are community surveillance, isolation stations, case management, control safe burials, and widespread education. Primary prevention strategies are designated to prevent the onset or initiation of a disease prior to the disease outbreak. Similarly, primary prevention aims to reduce the incidence and prevalence of an existing disease. A current primary prevention method used for Ebola is to practice safe and careful hygiene. As a part of primary prevention, healthcare educators advise washing hands with soap and water as well as using hand sanitizer. A population at risk should not handle any item that has potentially been exposed to Ebola. Education is a necessary mechanism of primary prevention because without educating the population on what and what not to do, there will be no conscious effort to control the spread of the disease. Secondary prevention aims to reduce the impact of a disease or injury that already exists. An example of secondary prevention used for Ebola is mandatory screenings for a community at risk for infection. Travelers should be required to get screened if they travel from a country where Ebola is prevalent. These screenings can monitor for evidence of clinical illness such as fever, headache, nausea, etc. These screenings could also assist with early detection of Ebola and prevent further transmission. Tertiary prevention measures aim to treat and decrease the impact of an occurring and present illness or injury. Currently, there is no cure for Ebola. There are two effective tertiary prevention methods. The first is treating the symptoms with medication in a controlled environment. Another technique would be to provide personal protective equipment to those who are already infected to limit possible transmission.